What is phenotype in genetic test results? Have you ever wondered how our genes shape who we are? Today, we will discuss the concept of phenotype and its role in genetic test results. A phenotype refers to the observable traits or characteristics of an individual. This can include features like height, eye color, blood type, or even the presence of certain diseases. In the world of genetics, phenotype is the visible outcome of the interaction between a person's genetic makeup, known as genotype, and various environmental influences. Every individual has a unique genotype, which consists of the genes inherited from their parents. These genes provide the instructions for building and maintaining the body. However, the genotype alone does not determine which traits will be expressed. The phenotype is the actual expression of those genes, influenced by factors such as diet, lifestyle, and exposure to environmental elements. For instance, two individuals may carry the same gene variant for height, but their actual heights can differ due to nutrition or health conditions. In family genetic testing, understanding phenotype is essential. It helps connect genetic variants to physical traits or health conditions. For example, if a genetic test identifies a variant linked to a hereditary disease, the phenotype would be the symptoms or clinical signs exhibited by the person. Genetic testing often looks for specific phenotypes to guide diagnosis or treatment, especially when a disease has a known genetic basis. Phenotypes can encompass various traits. These include physical traits like hair color and skin pigmentation, physiological traits such as blood type or cholesterol levels, and medical conditions or disease symptoms linked to genetic variants. It is important to note that phenotype does not always reflect a genotype in a straightforward manner. Environmental factors and complex interactions among genes can influence how a genotype manifests as a phenotype. This means that two individuals with the same genetic variant may present different phenotypes. In clinical genetic testing, phenotype information is used alongside genotype data to interpret the significance of genetic variants. For example, if a person has symptoms that match a known phenotype associated with a gene mutation, this strengthens the evidence that the mutation is causing the condition. This approach helps clarify test results and improves the accuracy of diagnoses. In summary, phenotype in genetic test results represents the observable traits or clinical features resulting from the combination of a person's genetic code and their environment. It is a key concept for understanding how inherited genetic information translates into real-world characteristics and health outcomes.